So people, where are we in respiratory system in medicine, isn't it? So we have looked at the symptoms in the last video. So symptoms, cough, sputum, hemoptysis, wheezing, chest pain, breath sounds, etc. All that we have seen. Now it is time to look at the signs. Okay, signs means you will look at the physique, the chest shape, etc. Pyrexia, fever, dyspnea, tachypnea, that is the difficulty in breathing, fast breathing, all that. Dyspnea is difficulty and tachypnea is fast, right? Dyspnea is what? Difficulty? Yeah, difficulty, that's right. Then intercostal recession, if he is having some indrawing of the chest. Then breathing, is it abdominal breathing, thoracic breathing? You have to find that out. Cyanosis, if there's any bluish discoloration, which could be peripheral or central, isn't it? Action of the accessory muscles, is he's going on to use his accessory muscles for respiration? We have to check that. Clubbing, if there is clubbing, that is the nails actually. Any lymph node involvement in and how's the tracheal position? Is it deviated to one side? Shape of the chest movements, apical impulse, breath sounds you will hear in this case, and added sounds. So guys, please pay attention here in the exam. If they ask you what are the signs of respiratory system, you will have to explain these. What are the signs? As a doctor, what do you see? You will see there's chest indrawing, you will see that there's tracheal deviation, you will see that there is lymph node enlargement, there is, what did I say, indrawing of the chest shape could be deformed, right? Then you could see inspection, you could see apical impulse or palpated, the breath sounds could be abnormal, etc. Right? Let's get started with the inspection, guys. As such, what do you see? You will check the neck, right? Then they are coming to the examination of the respiratory system. Here you will check the oral cavity, guys. When they say examination of respiratory system, you have to start with the upper respiratory tract. Do not forget, otherwise you normally start off with the trachea, etc. So in this guy, you will have to check his mouth, right? First of all, upper respiratory tract, ask him to open and show the oral cavity, check the oral hygiene, the dental caries, the oral thrush, that is candidiasis, right? Tonsils, if it is swollen, right? Nose, you will check for deviated nasal septum. As such, just see from outside. We are doing inspection, right? Check for nasal polyps. Can you see any polyps externally? Then only, right? But otherwise, if you want to see if they are inside, you will have to touch the patient. Then what else can you check, guys? Lower respiratory tract, you'll have to check inspection. They are saying you will check the, let us say this is that man. Okay, you will check his supraclavicular area, intraclavicular area, mammary region, axillary region, and infraaxillary region. You will have to check. Okay, and at the back you will check the suprascapular, interscapular, infrascapular. All the three you will have to check. Okay. Trachea position, you will see this is inspection. There's something here called as a trail sign, that is there is undue prominence of the clavicular head of the sternocleidomastoid. Of what? Who is actually prominent? The sternocleidomastoid. What of the sternocleidomastoid? The clavicular head of the sternocleidomastoid is going to be very prominent. Okay, to which side the trachea has deviated? That side. So here you can see the trail sign. What are they showing you? Where's the sternocleidomastoid? Here, right? So if this is the sternocleidomastoid, the clavicular head, that's what they are saying, isn't it? The clavicular head will be prominent. Towards which side the trachea is pushed. Wait, they're showing yet another image here. This is the trail sign. They have marked this arrow is the trail sign positive. Okay, both. And here they're showing that the trachea is deviated. Let's read the sentence again. So there's undue prominence of the clavicular head of the sternocleidomastoid on the side to which the trachea is deviated, to whichever side the trachea is deviated. So whichever side, let's say it was deviated this way, then that side there is undue prominence of the clavicular head of the sternocleidomastoid. Okay, that is the trail sign. We're going fast. We're looking at the signs in the respiratory system. So we look at the position of the apex beat. Okay, symmetry of the chest you will have to look at. Is there drooping of the shoulder, hollowness or fullness of the supraclavicular region? Is there crowding of ribs, kyphosis, scoliosis? You'll have to look at. What is kyphosis? Forward bending of the spine is kyphosis. Lateral bending of the spine is scoliosis. So lateral bending of the spine is scoliosis. It's more like an S, is it? And kyphosis is the forward bending of the spine. Here you can see, guys, scoliosis is the lateral deviation, kyphosis is the forward deviation, and lordosis is what? How do you say what lordosis is? There is excessive curving of this lumbar part. Okay, so they have written it here. Look at this. Exaggerated lumbar curve is lordosis. Okay, so all this you can check. The spine. Basically, here they are more concerned about kyphosis and scoliosis, not about lordosis, because that's much below your respiratory system, isn't it? What are we looking at, guys? We are looking at the signs. Okay, so look at the chest deformities. Is there any chest deformity in this guy? Is there a flat chest where like you will see in pulmonary TB, etc.? Is there a barrel chest? Is there a pigeon chest like pectus carinatum? Look at this photo here. This is a pigeon chest, pectus carinatum. Okay. Then what else are they talking about? Pectus excavatum, funnel chest or a cobbler's chest. That is more inside, isn't it? Of excavatum, funnel chest, cobbler's chest. Here they are showing you the excavatum. See, look here you have the spine, the vertebra. So here you can see the pectus excavatum looks like. Here you can see pectus excavatum, isn't it? So basically it is so much inside. There is some more here that they're talking about Harrison's sulcus, indrawing of the ribs. Something is there. Then rickety rosary. In rickets, there is some condition, bead-like enlargement of the costochondral junction. And there's so much, guys. Let's move on. Then you have the spinal deformity. We already spoke of this. Kyphoscoliosis. Are they talking about mixing both the things here? And they're talking about ankylosing spondylitis, where there is diminished volume of the lung and capacity of the chest, thereby the capacity of the lung to expand is restricted. So what happens in ankylosing spondylitis? The chest itself is so small, isn't it? So here they are showing you a healthy spine and how it is in ankylosing spondylitis. So basically in respiratory system, you'll have to note that these people have very little place for expansion of the lung. Let's look at the movement of the chest now. When you're talking about the movement of the chest, you'll have to talk about the rate, the rhythm, equality, and type of breathing. So is it equal on both sides? What is the rate, right? Respiratory rate, this you know. Rhythm, is it regular, irregular, etc. And the type of breathing. Let's look at this. So what is the normal respiratory rate that you breathe with? Yes, it is around 14 to 18. Please remember this, 14 to 18, okay? In children, it varies very, very much. Like when it's born, it's around 60. And then after a few months, 50. So just remember, when it's born, a newborn will have around 60, right? You should know. That's not unusual. So you should know that. For adults, remember 14 to 18. Guys, pay attention. What are we looking at? The respiratory rate. In women, the type of breathing is thoraco-abdominal, and in men, it's abdominothoracic. Now, how do you understand this? So basically, it is abdominothoracic in males, right? So basically, what happens in inspiration, the diaphragm descends, right? The diaphragm goes down because you can take in more air, right? And it pushes the abdominal viscera down. So abdominal wall is raised. So what happens is, let us say these are the lungs and here's your diaphragm. So when you breathe in, the diaphragm gets pushed down and the abdominal viscera also goes down and the abdominal wall is raised. The abdominal wall is raised. Thus, abdominal movement is more prominent. The abdominal movement is more prominent in males, okay? Let's look at the thoraco-abdominal breathing in women. So here what happens in females and children, the movement of the chest wall is prominent during respiration. What happens? The diaphragm's movement is restricted, okay? Which they do not know why. Why? Just imagine she's pregnant, the diaphragm doesn't go down. Something like that you remember, because in females, the diaphragm movement is, the descent of the diaphragm is restricted. So exact cause is not known. Therefore, there is movement is more in the chest, the rib cage. So the thoraco-abdominal breathing happens in females and children, okay? So what is fast breathing in adults? If it's more than 20 per minute, it is fast breathing. Please note this, okay? So why will it happen? All that you will look at. Bradypnea is, there is decreased rate of respiration. It can happen for a lot of reasons. Then you have hyperapnea. No, there is no A. There is no, it is hyperpnea. Hyperpnea basically is increased in depth of respiration. The person is breathing and he's taking a deep respiration, right? Hysteria can cause. So rhythm, guys. So the rhythm, what and all will you see? Inspiration, expiration, basically you will breathe in, breathe out, breathe in, breathe out, right? What else will you say? Which are the accessory muscles? Okay, first of all, let us look at the important muscles. For inspiration, you will use what? External intercostal muscles and the diaphragm you will use. So it is brought about, inspiration is brought about by the external intercostal muscles in the diaphragm. Expiration is brought out, it's a passive process, it doesn't use anything, looks like. Okay, just remember, which muscles are you using for breathing? External intercostal muscles and the diaphragm, okay? These two you're using for breathing. What are the, when you are having a struggle to breathe, you will use the accessory muscles of inspiration, which will be the scalene muscle, the trapezius muscle, and the pectoral muscles, okay? Scalene muscle, trapezius muscle, and the pectoral muscles, okay? What are the muscles of expiration which are accessory? You have the abdominal muscles and the latissimus dorsi. So even to expire, if you have started using your muscles, imagine how it would be, right? Because expiration itself is a passive process, and now you have started using muscles like the abdominal muscles and the latissimus dorsi. Just remember, what do you use normally to breathe are your external intercostal muscles and the diaphragm. And if you're taking a forced inspiration, you will use the accessory muscles of inspiration, which are like the trapezius, the scalene, the trapezius, and the pectoral muscles. Okay. So what are we doing, guys? We're looking at the respiratory system. So we're looking at the signs. Basically, we're looking at inspection here. So abnormal breathing sounds, you can see Cheyne-Stokes breathing. Then you have Kusuma's breathing, which can be abnormal. Here they have shown you the Cheyne-Stokes breathing. Okay. Then Kusuma's breathing also be mentioned. Irregular abnormal breathing patterns. Irregular also. And abnormal. So biots breathing, ataxic breathing, apneustic breathing, cogwheel breathing, pursed lip breathing. Too many terminologies here, guys. I would say what we have looked at now is just the inspection. So in inspection, what and all did you see? So let us write down. You saw the shape of the chest. Very good. Did you see the, one second, let me move it here. Yeah. So did you see the position of trachea? Yes, trachea position you saw. Apex beat you wanted to see. Then you saw the shape of the chest. Then what else did you see in inspection, guys? Chest deformity, spine, all that, kyphosis, scoliosis, all that you saw. Chest shape you saw. It could be, what is that? Pectus excavatum, pigeon chest, that is called as pectus carinatum, barrel chest, flat chest, so many things you saw. Then basically in chest, when you're inspecting, you should look for engorged veins, intercostal scars, any sinuses, right? You'll have to look for all this, any drooping of shoulder, etc. Then movement of the chest. Let's come to movement of the chest. You saw that the movement of the chest in how will it be? Here you will have to talk about the rate of the respiration. It will be around 14 to 18 in adults. If it's more than 20, it's tachypnea. Then you saw that there is something called as bradypnea if it's less, and if it's deep, more deep, you're calling it as hyperpnea, right? Then you have rhythm. When it comes to rhythm, you saw that there will be inspiration and expiration. Inspiration, you're using the external intercostal muscles and the diaphragm. Expiration is a passive process. Then you have abdominal breathing patterns like the Cheyne-Stokes breathing, Kusuma's breathing, etc. What else? I thought there was something more here to tell. Movement of the chest. Here we saw something like the abdomen. In males, it is more like abdominothoracic, and in females, the movement while breathing is thoraco-abdominal, right? So this much we have covered in inspection in the respiratory system. Next, we will continue with the palpation. Okay, so we have in science, we have looked at inspection, and now we will look at palpation in the next video. Okay, so what have we been looking at? Respiratory system. Guys, so we want to look at the inspection, right? So for all this, you should know anatomical landmarks, the trachea, the major interlobar fissure, minor interlobar fissure. You should know the bronchopulmonary segments, right? They have shown here. Then look at this. Right side and left side, right upper, middle, lower, and left is just upper and lower in the lateral view and in the posterior view. So posterior view, again you have upper, lower only. Guys, and for this respiratory system, some diagram has been made very nicely by somebody. Just look at this. Anterior thorax, lateral thorax, posterior thorax. Look at everything that you have to look for in the inspection. You have to look for the shape of the chest. They're saying ellipsoid here. Then you look for the respiratory rate and rhythm. Okay, then you look whether it is abdominothoracic or thoraco-abdominal. Then look for if it is bilaterally symmetric, right? The movements. Then bilateral equal movement, symmetric and equal. Okay, then they're talking about use of accessory muscles. Is this person using accessory muscles to breathe? Accessory muscles would be the scalene muscle, the trapezius muscle, and the pectoral muscles. These are the accessory muscles of inspiration. If the person is using his effort to expire also, then he will be using his abdominal muscles and the latissimus dorsi for expiration. Otherwise, expiration is a passive process. And then look at this, guys. Once you're done with whether he's using accessory muscles, they're saying here that you can look for the trail sign. Okay, that is where the clavicular head of the sternocleidomastoid will be prominent because of the same side deviation of the trachea, right? That's the trail sign. Then what else will you look for? You will look for apex beat, is it visible, etc. Then you look for any dilated veins or visible pulsations. So this completes the inspection, okay? Or you can say this is the inspection of the respiratory system.